So I'm going to explain that a little bit more, and I want to just show you a couple pictures here, okay?
Okay.
So if you look at complete cytogenic response rate in the chronic phase, it's about 80%. If you look at the accelerated phase, it's about 15%. So the drug doesn't work in advanced disease very well. Now, if you look at patients who got a complete cytogenic response as their best response, like in the IRIS trial, their risk of ever progressing in the next 4 years, about 48 months roughly, is about 8% overall.
That's good.
Yeah, it is good. And now this is divided into people who become Philadelphia chromosome positive but appear to be in a chronic phase. And half of these people go to accelerated phase or blast crisis. If you look at people who had complete cytogenic responses, this is people who had complete cytogenic response at any time in the trial. If you look at people who are there, a complete cytogenic remission at 6 months like you, there's a probability is less than 5% or so.
Over 4 years?
Yeah, over 4 years, right. Now, if you look at the curves right here, truth be known, there's a steady decline. It's about a risk of losing progression overall in the study of somewhere between 2 and 4% per year.
Wait, can you say that part again? I didn't quite follow you.
Something tells me that she is not the only person who at this point would have a hard time following what's been going on. What the two of us just did was reenact an actual encounter between a hematologist, that's a doctor who takes care of blood diseases, and a patient of his who had leukemia, that's a cancer of the white blood cells. This doctor, was earnestly trying to educate his patient about her illness in hopes that they could decide what treatments that would be best for her to undergo. Good decision-making requires good understanding of one's illness and of one's treatment alternatives. And the new paradigm of patient empowerment and shared decision-making really have to depend on doctors and patients to talk to each other well enough that each understands what's going on. In critical decisions, I give patients lots of advice about how to help themselves and prepare themselves for these important decisions you might face or your loved ones might face. I give lots of advice there to physicians too. And to both patients and physicians, it starts with this simple advice. Make sure the language you use talking to each other doesn't get lost in translation.